Most people do not know their true blood pressure. They know the number they got while talking, sitting crooked, wearing the wrong cuff, and wondering why the machine looks angry. Blood pressure is unusually easy to measure badly. A small cuff, unsupported arm, crossed legs, full bladder, recent caffeine, or skipped rest can move someone into a different category. So before we ask how high is the number, we need to ask, did the number earn the right to be interpreted? Today we are building the 2026 home blood pressure decision tree. By the end, you will know how to collect a 7-day average, what 138/86 actually means, why the doctor's office may disagree with your living room, and when a high reading becomes an emergency. The machine gives you a number. The protocol tells you whether that number means anything. First, use the right device. The best home option is a validated automatic monitor with an upper arm cuff. Wrist, finger, ring, and smartwatch estimates may be convenient, but current US guidance says cuffless devices are not yet reliable enough for diagnosis or medication decisions. The cuff must fit your actual arm, not your optimism about standard adult. In one randomized trial, using a regular cuff on someone who needed an extra-large cuff exaggerated systolic pressure by nearly 20 points. The same person could appear to jump from roughly 125 to 144 without any biological change. That is not a small error. That is the machine accidentally writing a different medical story. Now position. Sit in a chair with your back supported, feet flat, and legs uncrossed. Put the cuff on bare skin and support the arm so the middle of the cuff is level with the heart. Do not let the arm dangle beside the chair. Research found an unsupported arm could raise the reading by roughly 6 points systolic and 4 points diastolic. If your arm is hanging down, gravity has joined the appointment without being invited. Now the preparation rules. For 30 minutes beforehand, avoid exercise, nicotine, caffeine, and alcohol. Use the bathroom first. Then sit quietly for 5 minutes. No talking, no texting, no email, no news, and preferably no staring at the machine, as if intimidation will lower the number. The 5-minute rest is not dead time. It is part of the test. Take 2 readings 1 minute apart and record both. Do not keep measuring until the machine finally gives you a number you like. That is not monitoring. That is negotiating with electronics. Now the 7-day protocol. For 7 consecutive days, take 2 readings in the morning and 2 in the evening, 1 minute apart. That creates 28 readings and turns a noisy snapshot into a pattern. Morning readings are usually taken after using the bathroom, before breakfast, and when possible before blood pressure medication. Do not delay or skip prescribed medication to run this experiment. Keep the routine consistent and follow your clinician's instructions. Repeat near bedtime under similar conditions. Avoid measuring immediately after exercise, an argument, a hot shower, large meal, or alcohol. Record both numbers, pulse, time, and anything unusual. At the end, average systolic and diastolic readings separately while preserving the raw results. Blood pressure naturally fluctuates. The average is the signal. The individual readings are the supporting cast. Now what do the numbers mean under current US categories? Normal is below 120 and below 80. Elevated is 120 to 129 with the bottom number still below 80. Stage 1 hypertension is 130 to 139 systolic or 80 to 89 diastolic. Stage 2 is 140 or higher systolic or 90 or higher diastolic. The word or matters. A reading of 118/84 is stage 1 because the bottom number is elevated. A reading of 146/76 is stage 2 because the top number is elevated. The higher category wins. One number does not get to cover for the other like a very loyal friend. So the thumbnail reading, 138/86, is stage 1 hypertension. It is not an emergency, and one reading does not confirm chronic hypertension, but a properly measured 7-day average around that level deserves action. The top number is systolic pressure, the peak pressure while the heart contracts. The bottom number is diastolic pressure, the pressure remaining while the heart relaxes between beats. Systolic pressure often becomes the stronger risk predictor after age 50 as arteries stiffen, but diastolic pressure still matters. One is the peak, the other is the baseline. Neither gets erased. Now the one scary reading rule. If the number is high but below the severe range, stop talking, check the cuff and position, rest quietly, repeat it, and record both values. Pain, illness, poor sleep, stress, stimulants, decongestants, temperature, exercise, and technique can all push pressure temporarily. One high reading is evidence. It is not automatically a diagnosis. But do not use that as permission to ignore it. An isolated spike may be noise. A repeated home average is a pattern. A pattern combined with cardiovascular risk tells us how aggressively to respond. This brings us to white coat and masked hypertension. White coat hypertension means readings are repeatedly high in the clinic but normal outside it. Anxiety, rushing, pain, conversation, and bad office technique can contribute. But white coat hypertension should not be dismissed as harmless. It can progress to sustained hypertension and has been associated with higher long-term cardiovascular risk than consistently normal pressure. Masked hypertension is the reverse. The doctor's office reading looks fine, but home, work, or nighttime pressure is elevated. That can be dangerous because everyone believes the issue is controlled while the arteries receive a different memo outside the clinic. If office and home readings strongly disagree, a 24-hour ambulatory monitor may be the best tiebreaker. It measures daytime and nighttime pressure instead of asking one office reading to represent an entire life. Now the biggest change in the modern decision tree. The number is only half the decision. Current guidance recommends medication plus lifestyle for an average of at least 140/90. It also recommends medication for selected people averaging at least 130/80 when they already have cardiovascular disease, a previous stroke, diabetes, chronic kidney disease, or an elevated 10-year prevent cardiovascular risk score. For a lower-risk person with stage 1 hypertension, the first step may be an intensive 3 to 6 month lifestyle trial. If the average remains at least 130/80, medication enters the conversation. So two people can average 136/84 and receive different plans. A younger person with low cardiovascular risk may begin with weight management when needed, a DASH-style eating pattern, sodium reduction, exercise, better sleep, less alcohol, and follow up. A person with diabetes, kidney disease, a previous stroke, or established cardiovascular disease may benefit from medication now rather than waiting several months. The number is the same. The benefit of treatment is not. Lifestyle first also does not mean lifestyle only forever, and medication does not mean lifestyle failed. Lifestyle is the foundation for everyone. Medication is another tool when the average and risk context say the arteries need more help than good intentions can provide. Now the emergency split. If the reading is above 180 systolic and/or above 120 diastolic, wait at least 1 minute and measure again using correct technique. If it remains that high without new concerning symptoms, contact a healthcare professional immediately for timely guidance. It is serious, but the number alone does not automatically prove a hypertensive emergency. If it remains above 180 and/or 120 with chest pain, shortness of breath, back pain, new numbness, weakness, vision change, difficulty speaking, confusion, or another severe new symptom, call 911. Do not drive around collecting opinions. Do not wait for the cuff to become more encouraging. Severe pressure plus possible organ injury is the emergency. Here is the full decision tree. Use a validated upper arm monitor. Fit the cuff. Prepare correctly. Support the arm at heart level. Rest 5 minutes. Take 2 readings and record both. Unless the situation is urgent, collect 2 morning and 2 evening readings for 7 days. Average honestly. Compare home and office patterns. Then add cardiovascular risk context. Normal or elevated pressure calls for prevention. Lower risk stage the 1st of May earn a focused lifestyle trial. Higher risk stage 1 and stage 2 deserve a medication discussion. Severe readings require immediate attention, especially with symptoms. If this gave you a better way to understand the machine instead of fear it, tap like, subscribe to Longevity Compass, and check the description for our Amazon KDP book, a validated upper arm monitor, and tools for keeping an honest 7-day log. Because your blood pressure is not the highest number the machine has ever displayed. It is the pattern that appears when the measurement is finally done correctly.